Researchers in London estimate that if everyone routinely washed his or her hands, 1 million deaths a year could be prevented. Feces from people or animals are sources of germs that cause diarrhea. These kinds of germs may get onto hands after people use the toilet, change a diaper, or handle raw meats that have invisible amounts of animal poop on them. A single gram of human feces, which is about a weight of a paperclip, can contain 1 trillion germs. A large percentage of foodborne disease outbreaks are spread by contaminated hands. Although people around the world clean their hands with water, very few use soap to wash their hands. Washing hands with soap removes germs much more effectively. Access to soap in schools can also help improve classroom attendance. Inadequate sanitation increases the incidence of diarrheal diseases. Improved sanitation facilities can improve this condition. Hand washing with soap removes germs from hands. This prevents infections because people frequently touch their eyes, nose, and mouth without even realizing it. The World Health Organization estimates that as much as 24% of global disease is caused by environmental exposures. The topic of health, as a general movement, is largely innovation-heavy and desperate for new technologies every year. However, the approval of polymer-based drug formulas and prototyped hospital machinery is slow and resource-taxing. The implementation of a smaller project with an idea that is both broad and grand is more pragmatic and a greater and better use of time and energies. With implementation at a college campus, there is a decrease in problem testing space. However, there are more available subjects and ease of data collection. An increase in sanitation would be ideal. Too often, an overwhelming number of infectious agents are spread through hand-to-hand contact. However, hand-to-object contact is constantly overlooked. Attention and caution must be applied in lieu of the commonplace disregard and negligence to microbe transmission. Areas of high population density would benefit from the success of increased sanitary practices. In fact, the overwhelming majority of geographic locations in the modern world have areas in which masses of individuals congregate. Control and promotion of better sanitary practices with a focus on an increase in the prevention of microbe spread will be advantageous in all of these places.